Today we're covering antecedent interventions, and the most important idea to keep in mind from the very beginning is this. Antecedent interventions are about prevention. In ABA, an antecedent is anything that happens before a behavior and influences the likelihood that the behavior will occur. So instead of waiting for behavior and then reacting with consequences, antecedent interventions change conditions in advance. That's why this topic is so important on the BCBA exam. It tests whether you can think proactively rather than reactively. Antecedent interventions matter because they reduce problem behavior before it starts. That is one of their biggest strengths. If we can change the environment early enough, we often reduce the need for more intrusive consequence-based procedures later. In other words, good antecedent interventions can decrease reliance on punishment, extinction, or repeated correction. On the exam, this is a very common distinction. If the strategy changes something before the behavior happens, you should already be thinking antecedent intervention. Formally, antecedent interventions are strategies that modify environmental conditions before behavior occurs in order to change the probability of that behavior. That might mean changing triggers, changing the context, changing discriminative stimuli, or changing motivating operations. And that last part matters a lot. A motivating operation changes the value of a reinforcer and therefore changes how likely behavior is to occur. So antecedent interventions do not just change the physical environment. They can also change motivation, and that is why they can be so powerful. The core idea behind this entire topic is that behavior does not happen randomly. Behavior is influenced by the environment, and antecedents set the stage for what is likely to happen next. That means if we change the stage, we often change the performance. A common mistake students make is focusing only on what happens after behavior, because consequences are easier to notice. But in practice, and definitely on the exam, the better question is often, what could have been changed before the behavior ever occurred? There are 4 major antecedent strategies in this deck, and each one works a little differently. Noncontingent reinforcement changes access to reinforcement before behavior occurs. High probability request sequence changes the order of demands to build compliance momentum. Stimulus control strategies change the cues that signal when behavior will or will not be reinforced. And functional communication training teaches an appropriate response that serves the same function as the problem behavior. These are not random procedures. They all work because they change what happens before behavior. Let's start with non-contingent reinforcement, or NCR. NCR means reinforcement is delivered on a schedule that is independent of the target behavior. That means the learner does not have to engage in the problem behavior to get the reinforcer. This is one of the most tested distinctions in the topic. If reinforcement is delivered regardless of whether the behavior occurs, that is NCR. Functionally, NCR often reduces problem behavior because it reduces the motivation to engage in that behavior in the first place. The examples on this slide help make that idea concrete. If a learner engages in attention-maintained problem behavior, you might provide attention every 15 minutes on a time-based schedule. If behavior is maintained by access to tangibles, you might schedule regular access to preferred items. If behavior is maintained by escape, you might build in regular breaks. The teaching point here is that NCR is not random free access. It should be based on the reinforcer that is actually maintaining the problem behavior. This slide covers classic NCR exam traps. The biggest one is confusing NCR with ordinary contingent reinforcement. In contingent reinforcement, behavior must occur first. In NCR, the reinforcer is delivered on a schedule whether the behavior occurs or not. Another trap is forgetting function. NCR has to match the maintaining reinforcer. If the problem behavior is attention maintained, then scheduled tangibles would not be the best NCR intervention. So on the exam, if you see time-based delivery matched to function, think NCR. Next is the high probability request sequence, often called HighP. This strategy is based on behavioral momentum. You begin with requests the learner is very likely to comply with, reinforce those responses, and then follow with a more difficult or low probability request. The idea is that a pattern of successful responding increases the likelihood of compliance with the harder task. So this is not just giving easy tasks first for comfort. It is a strategic sequence designed to increase compliance. The examples here show the logic very clearly. If a learner is likely to clap hands, touch their nose, and stand up, those requests can be presented first. Then, after those successful responses, you present the harder task, such as completing a worksheet. This works because the learner has already contacted reinforcement and built momentum. On the exam, when you see easy, high-compliance responses followed by a harder target demand, that should immediately signal high P request sequence. The traps with high P are all about getting the sequence wrong. If you start with the hard task, there is no momentum. If the so-called high-probability requests are not actually high probability for that learner, the strategy breaks down. If you skip reinforcement, you also weaken the whole procedure. So the exam is often checking whether you understand that the success of this procedure depends on the order, the actual probability of compliance, and reinforcement for those easier responses. Now let's move to stimulus control strategies. A discriminative stimulus, or SD, is a stimulus in whose presence a response has been reinforced in the past and is therefore more likely to occur again. An S-delta signals that reinforcement is not available for that response. Stimulus control means behavior occurs reliably in the presence of the SD and not in the presence of the S-delta. Antecedent intervention at this level is about making cues clear, consistent, and meaningful so the learner knows when behavior will be reinforced. This is why practical strategies like visual schedules, clear instructions, environmental cues, and organized materials matter. They are not just classroom management tools. They are ways to establish and strengthen stimulus control. A clear cue helps the learner discriminate what is expected and when reinforcement is available. So in revision terms, the concept to remember is that clear antecedent cues produce more predictable responding. When stimulus control is weak, behavior becomes inconsistent or confused. That can happen when cues are vague, when multiple stimuli compete for attention, when the same cue sometimes leads to reinforcement and sometimes does not, or when the learner cannot distinguish the SD from the S-delta. On the exam, if the scenario describes unclear instructions, competing signals, or inconsistent cueing, the best answer often involves improving stimulus control rather than jumping straight to a consequence strategy. Functional communication training, or FCT, is one of the most important antecedent interventions in ABA. FCT teaches a communicative response that is functionally equivalent to the problem behavior. Functionally equivalent means it produces the same outcome for the learner. So if screaming gets attention, the replacement communication response also has to get attention. If aggression gets escape, the replacement response has to access escape appropriately. This is why FCT is not just teaching any communication. It is teaching communication that matches function. The examples on this slide are exactly how the exam likes to test FCT. Instead of eloping, the learner requests a break. Instead of throwing materials, the learner asks for help. Instead of yelling for attention, the learner appropriately bids for attention. Instead of grabbing, the learner requests the item. The key teaching point is this: the replacement response must be socially appropriate, but it also has to work for the learner. If it does not contact the same reinforcer, it is not a good FCT response. This slide compares FCT with extinction, and that distinction is very important. FCT teaches the learner what to do instead. Extinction removes reinforcement for the problem behavior. So FCT builds a new skill, while extinction removes the payoff for the old behavior. In practice, these are often used together because that combination is powerful. The learner gets a new, appropriate way to access the reinforcer, and the problem behavior no longer works. On the exam, if you see teaching a replacement response that serves the same function, think FCT. If you see withholding the maintaining consequence for problem behavior, think extinction. When choosing an antecedent intervention, the first step is always to identify function. That is the decision-making anchor for the entire topic. Once function is known, you match the strategy to the function and then consider whether the environment supports implementation. For example, if the problem behavior is attention maintained, NCR with scheduled attention may be appropriate. If the issue is escape, FCT for requesting a break may be appropriate. So this is not about memorizing isolated procedures. It is about function-based matching. This slide brings us back to the ABC model. The antecedent is what happens before behavior. The behavior is the observable action. The consequence is what happens after behavior and influences future responding. Antecedent interventions specifically target the A in this chain. And that matters because when you change the antecedent, you often change what behavior occurs and, over time, what consequences the learner contacts. So the exam logic is often, if the intervention changes what happens before behavior, it is antecedent-based. The hypothesis framework shown here is exactly how assessment should guide intervention. First, identify the antecedent condition. Second, define the target behavior. Third, identify the maintaining consequence or function. Then choose an antecedent modification that addresses that pattern. For example, if difficult academic work triggers aggression because the learner escapes the task, then an antecedent intervention might include breaking the task into smaller parts or offering choices before the work begins. That is a clean function-based antecedent plan. On the exam, antecedent intervention questions are usually scenario-based. They often describe the behavior, the triggering condition, and the likely function, and then ask which antecedent change would be most appropriate. So your sequence for answering should be very systematic. First, ask what happens before the behavior. Then ask what function is likely maintaining it. Then match the antecedent strategy to that function. This is one of those topics where clinical reasoning matters more than memorized wording. This slide reviews several very common exam confusions. Antecedent versus consequence is about timing and role. Antecedents come before behavior and set the occasion, while consequences come after behavior and affect future probability. NCR versus reinforcement is about contingency. NCR is time-based and non-contingent, while reinforcement is behavior contingent. High P versus prompting is another common confusion. High P builds momentum through easy requests, while prompting is assistance used to evoke a response. And FCT is not just general teaching. It is specifically teaching a communicative response that matches function. This is the function-to-intervention matching slide, and it's one of the most useful for revision. Attention-maintained behavior often suggests NCR with scheduled attention. Escape-maintained behavior often suggests FCT for requesting a break or help. Compliance problems may suggest high P request sequence. And stimulus confusion points toward clearer SDs and stronger stimulus control strategies. This is exactly the kind of mapping you want in your head during the exam, because it allows you to move quickly from function to intervention. To wrap up the main ideas, antecedents influence behavior. Prevention is powerful. Strategies must be matched to function, and changing the environment is often the best first move. That really is the heart of antecedent interventions. They represent the proactive side of ABA. Instead of asking only how to respond after problem behavior, we ask how to arrange the environment so that more appropriate behavior is likely from the start. As you revise this topic, focus on 3 things. First, be able to identify antecedent variables in a scenario. Second, be able to distinguish the major strategies, especially NCR, high P, stimulus control, and FCT. Third, be able to match each strategy to function. If you can do those 3 things consistently, you'll be in a strong position for antecedent intervention questions on the BCBA exam. And if you want extra practice, you can work through full mock exam questions at www.bcbamockexam.com.